the school committee, because they're a public body and have a public debate about the budget, gets asked a lot of questions, and a lot of things go on the town side happen in my office when we're talking about the budget. And so, for instance, the police budget request was slashed by $250,000. The fire budget was slashed by $250,000. The DPW budget was slashed by $350,000 in order to get to a balanced budget. So, by way of example, in 2007, in 4 years later, the police budget's up $100,000. The fire budget's down a couple $100,000 4 years later. And I can go through it. I think just you see the general trend. You talk about the effects in the public education side because it's just more transparent, but we deal with those same issues. We're as well blessed by great employees and great leadership to make ends meet, but it's not without ultimate consequences. And just because the fire chief's here, if he could just take a minute to explain potential implications. Be so kind.
Good evening. Thank you. As you know, we've lost position. As Mr. Nutting said, we're significantly behind where we were in previous years. We currently have 3 line positions open, a prevention position open. We have no clerical support. So a lot of people are doing a lot of good things to try to provide the best level of service possible. We look at last year, if you recall, we were funded 6.5% less than the previous year. We were fortunate enough to get a stimulus grant, and that's why we haven't yet had to reduce service levels, because we've been able to turn that money into overtime and keep staffing levels where we are. We're seriously looking at making decisions of how not to run out of people. If you recall, with the funding, with the $250,000 reduced, we'll have to go down to 9 people on duty, which causes us the question, can we staff a second ambulance or not? EMS is our highest level of service. The problem with staffing 2 ambulances is we lose 4 people out of the community for about an hour. 44% of our call volume happens back to back. So you get one call, you get another call before the first one resolves. So if that happens, I lose 4 people out of a system. And if other calls happen, I quickly come into a scenario when you call 911 for a fire rescue emergency and my dispatcher has to tell you you're on a queue. That's wholly unacceptable. So we're trying to partner with surrounding communities. As we all know, there's a mutual aid program. The problem is that in each contiguous town that we partner with, they're all having this level of discussion with their selectmen and their counselors. So, when we call Bellingham, Rentham, Norfolk, we'll be told, you're in the queue, we'll get to you when we can get to you. So it becomes very problematic. Additionally, with the double hit with the ambulance service is we do generate some revenue from that. So if we give up a couple of 100 calls a year because we can't respond, we give up the revenue associated with that. So next year's receipts go down. In addition to not being able to provide basic and advanced life support within 8 minutes and giving you a probability of survival of 50% or better, not being able to interrupt the progress of flame before 8 minutes, which we know that if we can't do that, after 8 minutes, the probability of mortality goes up by 7-fold, the probability of injury goes up by 12-fold, and the probability of property loss increases by about 17, a factor of 17. So those are the types of things that we see happening. The problem is, everybody says, well, we don't have fires in Franklin. Well, I go to 24 to 36 of those every year. So we do have fire in Franklin. We don't get a lot of press, but we go to those incidents. So that those numbers are real. We benchmark against performance standards. We continue to do a good job and meet our benchmarks. The backdrop of all this is that the northern part of Franklin, which 10 years ago we had a fire station committee because at that point the town said, we're going to have some fire problem up here. We're not achieving overall on-time response because we have a growing number of responses in the north part of Franklin. So we have underserved populations, and our resources to deal with those are dwindling.
On your fire calls, how many fire response did you have last year, roughly?
Roughly 1,000.
Okay, does that include the truck who follows the ambulance every
No,
time?
it doesn't.
Okay, that's all I have then.
Yeah, those, and specifically, we send the engine behind the ambulance because we know that if we can provide shorter on-scene times, we can provide better outcome for the patient in general.
That's a big gripe in the whole country, Chief.
Well,
The police are the first ones to respond. The police are there already 90% of the time.
But
They're willing to help.
But they're not certified at the level that the firefighter paramedics are.
No, they're not, but you got 2 paramedics there now. Well, you need those extra help in case you got some person who has to be carried out, you need more help.
Well, and you need more help when somebody's suffering a severe diabetic emergency, when somebody's suffering cardiac arrest. It takes 5 people to manage a cardiac arrest to do the best we can. Chief Williams just explained to you he's not going to leave people back. I'll send 5 people to the hospital to give that patient every benefit I can of survival and positive outcome. It's not a frivolous waste of time. It truly isn't. The outcomes are important. And it's important to everybody to give them that opportunity. We're in the opportunity business.
Well, it's a lot of wear and tear and the extra engine and the gas they use and the wear, depreciating that fire truck. That should be taken into consideration also. That's very, very expensive.
Without a doubt, but the problem is that I would be derelict in my duty if I left resources in the building when I know that I could have a positive impact to those folks because I didn't want to have wear and tear on the vehicles.
Everything is overkill in this country anyway. Anyway, that's all I have to say.
I have school committee.
Very frustrating.
Shannon?
Thank you. I've heard enough for myself. I mean, now we're talking about life and death, and we're debating whether that's important. We're talking about the education of our children.
That's
We're
bone.
That's bone.
What did we learn?
That's right. We're talking about the welfare of our seniors. We're talking about the welfare of our less capable of protecting themselves, whether they be children or physically incapable people. We're talking about the security of our town. We're talking about violence. We're talking about things. I'm starting to sit here wondering, whose town is this? This is Franklin. We are all from Franklin. When are we going to step up and take some pride in our town and say, sacrifice has to be made, we need to pay more because things cost more, and it cannot be the same as it was 10, 15, 20, 30 years ago. We're 32,000 people, we live in a great town, our schools outperform the averages, our town employees perform with less resources than anybody I can see, our fire and police do the same, our senior citizens have a senior center that serves subsidized meals that seniors rely on to get by in their daily lives, but it costs money. And I really am having a hard time understanding why we're even debating whether we should be resisting these cuts. This is not the town that I moved to. This is not the town that I believe that I live in. And I can't fathom how a rational person looking at these statistics can take any other position. Reasonable people can disagree on certain points, I will grant that. But that's not what we're talking about now. We're talking about crucial, vital services at every level of our town. And you can't get something for nothing. It's a basic principle of our society. And the fundamental strength of any town and any society is how it takes care of its most vulnerable people. And I include children in that, I include seniors in that, and I include those that can't take care of themselves in emergency situations. So from my point of view, the next discussion point here should be whether we put an override on the ballot, what the amount of that override should be, and I would be very interested in the number of the citizens that are sitting here, which is a disproportionate amount than usual, what their perspective is on some of these issues, because I'm having a hard time understanding how there could be a significant difference of opinion with some of the things that have just been stated. Thank you.